We teach over 1,000 students a year on ice rescue, river rescue, and wilderness first aid and first responder courses. After watching this video, you will be clear on how to recognize and treat hypothermia. We're going to cover mild hypothermia, severe hypothermia, the treatment at those different stages, and also get into the conversation about whether or not you should do CPR if you're not sure if the person has a pulse. We talk about 3 different levels of cold. The first is cold response, then we have mild hypothermia, and then severe hypothermia. We want to differentiate between these because our treatment is going to be different depending on which stage we're in. If you were to go outside on a cold day and not have proper clothing, our bodies would do a few things in order to compensate. One is what we call the shell to core effect, and that's where our blood vessels in our shell, which is our skin, our extremities, areas that are kind of less vital, constrict and send blood to the core. And you can see that by somebody's skin getting pale, or if they have darker skin color, you could look at their lips and see that those get pale or blue. We also start to shiver. So when we shiver, that generates heat in our muscles by burning calories, and that actually heats us up. And so as long as you have enough calories to burn and that shell to core effect is working, we're able to maintain a core temperature of around 37 degrees. Our bodies need to be internally at about 37 degrees Celsius in order to function. As soon as our core temperature starts dropping down, our organs start to malfunction and we could eventually die. So we call that stage cold challenge, when you might feel a little bit cold, but your core temperature is still around normal. As you start losing more heat than you're able to create or that you're able to retain, your core temperature actually starts going down, and that's what we call hypothermia. We define mild hypothermia by the person still being awake, but their brain starting to be altered. So what we call an altered mental status, and sometimes we use the term the umbles. So the person's stumbling, mumbling, fumbling, tumbling, bumbling. Maybe they're losing fine motor control, so they can't quite do up their raincoat, or maybe they start making bad decisions. They might have a change in personalities. We're also at a certain point going to get into uncontrolled shivering. So the person really starting to shiver. We call that mild hypothermia, and the treatment is going to be different between that and severe hypothermia. Once we get into severe hypothermia, without having an accurate core temperature, which we're not going to be able to do in the field, we go off of, again, their mental status. Somebody's now severely hypothermic if they're no longer awake. So at that point, another thing that happens eventually is the person will stop shivering and their vital signs will really slow down. So their heart rate, so their pulse rate will go down and their breathing rate will go down. And that is severe hypothermia. This is a big emergency and one that's very difficult to treat in the field. Really, this person's going to need to be evacuated to the hospital where they can be rewarmed through advanced procedures. So let's talk about treatment now for cold response. It is okay to do exercise. We all have maybe experienced that before, where somebody in your group's a bit cold and you get maybe doing jump squats or running around in order to generate more heat. That's totally fine as long as you can also maintain your calories and stay relatively equipped for the environment that you're in. Once we get into mild hypothermia, we're going to want to give them some food. That's really, really key. Give them some calories and give them an environment where their own shivering can warm themselves up. And so basically the person's going to warm themselves up. We just need to give them the fuel and the environment to do it. The fuel being calories, and at this point we want to give them simple sugars, things that their body can break down really quickly, and the environment being adequate layers or shelter in order for their heat not to be lost to the environment. There's 4 ways that we lose heat, that 4 kind of dynamics in physics where heat transfers from one object to the surrounding environment. One is conduction. So that's heat traveling from a solid, or heat transferring from a solid to another solid. The way we protect against losing heat through conduction is insulation. We want to have something under us protecting us from that colder object. That is maybe, for example, an insulate mattress or something with foam that's going to have that airspace that prevents that conduction from occurring. So something that insulates well. Next, we have convection. Convection is heat being taken away by the wind or water coming by us. We all know about the wind chill factor. When you're out at a certain temperature and then it gets windy, you feel much colder, and you actually are in a much colder environment because that wind chill or that convective heat loss is really going to be stealing your heat away. So the way to prevent heat loss from convection is to have either be in a sheltered area where there's no wind, stay out of water and certainly moving water, but also putting on layers that are like shell layers that are windproof and waterproof so that that wind can't come by and steal that heat away from us. Next, we also lose heat from evaporation. So that's liquid turning into gas, and that process, we know it works really well to cool us down. That's why we sweat in the summertime, right? And so we know in the summer when we sweat and that sweat evaporates, that pulls heat away from us. Well, in a colder environment, that's not helpful. And so if we're at all wet or damp and that liquid is evaporating, that's gonna pull heat away as well. And so one way to prevent that is to, one, have dry clothing on if possible, and to replace wet clothing, to dress properly so that we don't sweat too much and then have soaked clothing. So sometimes actually overdressing at the start could be a problem. And then another factor that we could use when we're treating somebody for hypothermia, if we can't get them dry, is to use what we call a vapor barrier. And so that's sometimes some sort of non-breathable, like plasticky tarp or tent fly or something like that, a bivy sack that we could wrap around the person right against their body. So even if they have some dampness or their clothing is wet, that liquid isn't going to evaporate and they're not going to lose heat through evaporation that way. The last mechanism is radiation. And so that's heat waves radiating away from us. You could think of ourselves kind of like a radiator, right? We put a radiator in a room and it warms up that whole building. Well, we are radiators too, but those heat waves are radiating away from us and being lost to the environment. And so having insulating layers around us so that heat can be trapped. And we know that things that work well for insulation are wool, fleece, down, as long as it's dry, those all work well for insulating layers. So back to the treatment for mild hypothermia. We want to give the person simple sugars, really important. Give them fluids as they can tolerate, and then also get them into an environment where their own heat is going to be maintained and trapped around them. We don't want to have somebody who's mildly hypothermic do exercise. We used to think that they should do exercise, but now we've seen through research that actually just laying down or being in a position not doing exercise and letting their own shivering warm themselves up is more effective. Exercise could even be dangerous in some situations. There's something called after drop that's important to know about. You might have felt this before when you were maybe cold and you get into a warmer environment, or you put on some layers and you actually get colder before you start getting warmer again. You might have actually started shivering even more and felt even colder. And that's because when you get back into a warm environment and when your body senses that, your blood vessels in your extremities open up again and your blood starts flowing through those cold extremities and then coming back to your core and actually dropping your temperature down. So we call that the after drop, and research has shown that exercise actually makes the after drop worse and last longer before you start warming up again. So for somebody with mild hypothermia, we're best not to have them exercise. They should just be ideally laying down in an environment where they're protected from the cold and their heat's going to be maintained, and we need to feed them simple sugars and fluids. Okay, let's talk about treatment for severe hypothermia. So severe hypothermia is a big emergency. We need to bring this person to a hospital, and not just any hospital. Ideally, they get to a hospital that has what's called ECMO. An ECMO is a way that the person's blood could actually be removed, filtered, warmed up, and then put back in. That's obviously very advanced. Not every hospital could do that, but that is the treatment that's going to be able to truly help somebody who's severely hypothermic. They'll do other things in the hospital as well, like blowing warm air all around them, giving them warmed IV fluids, sometimes injecting warm fluids into their abdominal cavity, giving them warm humidified air with ventilations. But really, none of those things work as well as ECMO. And so it's really important that we evacuate this person to an advanced care center as soon as possible. While we're evacuating them, we want to be gentle. If we jostle somebody around too much who's severely hypothermic, it could cause their heart to stop. That's because the cold heart is more prone to fibrillation, which is basically an abnormal electrical rhythm. So somebody's heart might be beating, it might be beating more slowly. However, if they're severely hypothermic, that's still managing to circulate their blood. But if we jostle them around, or if we take them from horizontal to vertical and tip them around too much, their heart could stop. And we're gonna usually package them in some variation of a hypo wrap or a hypothermia wrap. And we're going to use the different materials that we have, and depending on what other injuries might be present and the nature of our evacuation, we're going to try to protect them from any further heat loss and get them out. Any heat we could add to the packaging in the hypo wrap is considered good. We want to center that heat on the patient's chest. However, we don't want to do anything that's going to delay transport. Now, let's talk about CPR. This is actually a tricky one that's a little bit debated. If somebody's severely hypothermic, let's say we find somebody on a day like today, they've been missing and they're curled up under a tree or something like that, and we can't tell if they have a pulse. You might think, oh, we'll just do CPR. The problem is that their pulse could be really slow and very weak. If we do CPR, that's going to, one, delay transport, but it's also not very gentle. And so what we wouldn't want to do is CPR on somebody whose heart is actually beating, delaying us, and possibly causing their heart to stop. So we want to be very careful about that. So in our wilderness first aid courses at the more basic level, we teach if you find somebody who's severely hypothermic, you should be really cautious about jostling them around too much, start getting help and initiating an evacuation to get them to the hospital, and hopefully their vital signs will become detectable again as they become rewarmed. And so we teach not to do CPR in a case like that. If you have a more advanced level of first aid training and you're truly good at finding a pulse, this is something that you practice on real patients and practice in training as well, we recommend at least a 1-minute pulse check to determine whether the person has a pulse or not. And again, that should be done by somebody who's very good at finding pulses. And if we're not sure, keep checking, because you really want to make sure that we're not starting CPR on somebody who actually has a pulse. If they truly don't have a pulse, and that's been assessed by somebody who has adequate skill in finding a pulse, we believe that they truly are pulseless, then we should be doing CPR if possible while transporting the patient, but that's very hard to do without an ambulance or some sort of snowmobile toboggan system that you could transport somebody out with. It is possible, and something that's talked about in advanced training is doing intermittent CPR. And intermittent CPR means doing CPR for 5 minutes and then stopping for up to 5 minutes while you perhaps move the patient. So for example, we're moving somebody in some sort of toboggan or in off-road vehicle where we're able to do CPR during transport, and then we have to shift them into an ambulance when we arrive there. We could stop doing CPR for up to 5 minutes while we transfer them, and then repeat CPR again. Again, we think in this case, it's best to just keep going with effective CPR. Ideally, you're not stopping the CPR, but we give permission to stop to up to 5 minutes if that's gonna help with the evacuation. Let's talk for a moment about prevention. So to prevent hypothermia, we need to make sure that we're dressing adequately. We need to make sure in a rescue setting that if somebody falls in the water, we get them out as quickly as possible, or if somebody's in an area where they're being really affected by the wind or the rain or the snow, we move them to a sheltered environment as soon as possible. Definitely moving people off of the ground. A common thing in maybe standard first aid courses is that if a person's laying on the ground, we don't want to move them until people with more training get there. But if we're in the woods, somebody's laying on the ground for any period of time, even just a few minutes, they're really going to start losing heat to that environment. And so on our training courses, we really learn how to move somebody safely, but effectively and quickly onto some insulation so that they're not losing heat to the ground. Don't be afraid about moving somebody if you really do want to get them moved, because once the person's hypothermic, along with whatever other injuries they have, that's not going to be a good situation.